Let us look at normal range of heart rate, respiratory rate and blood pressure in children. Looking at the heart rate, in newborn babies it is quite high as 110 to 170 beats per minute. It is not unusual for heart rate to be as low as 80 or 90 and as high as 180 or 200 in newborn babies. Heart rate is also high in toddlers and infants, and as children become older, the heart rate changes to an adult parameter of 60 to 100, which means bradycardia in teenagers and adults is less than 60 and tachycardia is more than 100. A high heart rate is a common finding in pediatric age group when children come to the hospital with acute illnesses. Heart rate is also elevated with temperature, pain, emotional distress, or if you're doing any intervention. But it is quite unusual to have a low heart rate in children in the hospital. Similarly, respiratory rate in newborn babies and infants is as high as 30 to 50 breaths per minute. And again in young children, it is quite high and generally ranges from 25 to 35 breaths per minute in preschool children. And then they approach older children where respiratory rate is like an adult from 15 to 25 or 12 to 20 breaths per minute. Blood pressure systolic 50th centile is given here. This is not the cutoff for hypotension, which is defined as 5th centile, or cutoff for hypertension, which is defined as 95th centile. So you would find that newborn babies commonly have a systolic blood pressure of 60 to 80 millimeters mercury, and it rises in early young children, infants and toddlers, varying from 80 to 100, and thereafter in teenagers a systolic accepted is 100 to 120 millimeters of mercury.